One substance that we can use in the treatment of knee arthritis is hyaluronic acid. And I'm often asked about what hyaluronic acid actually is. Well, it's a naturally occurring substance that occurs in the body anyway. So 55% of your skin can be made up of hyaluronic acid. And it holds on to moisture, so it keeps things plumped up, which is often why you find it in face moisturizers, for example, to help reduce the signs of wrinkles. Now, with regard to joints, when they become a bit osteoarthritic, the joint fluid becomes a little bit more watery. There's a reduced quantity and quality of that hyaluronic acid in the joint fluid, and therefore they're not as good at absorbing direct compressive forces or with the friction in the joint. So this hyaluronic acid is like a thick gel that we can inject back into joints to help with cushioning and lubrication. Hyaluronic acid can come in different forms, so the manufacturers build their molecules slightly differently. So some are higher volume, some are higher molecular weight, some are lower molecular weight, and some have a mixture, a hybrid of the high and low molecular weight. So they all have different properties. So if you've had a previous hyaluronic acid injection and it didn't help, it doesn't mean that other hyaluronic acid injections won't help you. So if we have a look at a few examples that we provide here in the clinic, we'll just dollop a little bit onto this perspex screen and we can see the different makeup of each hyaluronic acid. So these are three different styles. One of them is a slightly lower molecular weight, one of them is a slightly higher molecular weight, and one of them is a mixture of the two. So we can see the different viscosities even by putting them out there on the perspex lid. If I leave that there, we'll just see what happens with gravity over time. So depending on the joint we're treating, we might change the type of hyaluronic acid that we recommend. We might use a slightly more silky, runny hyaluronic acid if we're looking for more lubrication within the joint or along a tendon sheath, for example. Whereas if we're after a little bit more compressive protection, if it's a big weight-bearing joint, then maybe we'll go for a thicker, higher molecular weight hyaluronic acid. Now, if we look already at what has happened here with the slightly lower molecular weight, the highest molecular weight, and then the hybrid, the one that's a crossover between the two. So it might be better for more lubrication, might be better for more cushioning, might be better for something where we need a little bit of both. So depending on the treatment, we will perhaps recommend a different hyaluronic acid depending on what you need to treat your particular problem. Hyaluronic acid will get broken down over time, so the body will eventually excrete that product and you may need to have that repeated. Now the upside is there's no negatives of having that repeated. It doesn't degrade the joint surfaces like repeated steroids can do. So once we've had an assessment of your knee, we'll then be able to work out maybe what's the best type of hyaluronic acid for you and then tailor make your treatment specifically to your problem. I hope that information is useful. If you have any further questions, then do get in touch.